Good morning, and thank you for joining us for our Brevard County coronavirus update. This is where we have a panel of guests joining us today for updates from their particular departments on how Brevard County is faring with the coronavirus. And today on our panel, we have Barry Inman, who is with the Florida Department of Health, Brevard, and we also have John Scott, who is our Emergency Management Director. We have Lance Skelly with Health First Hospitals, and we also have Catherine Allen, who is with Brevard Public Schools. And as always, we have Jesse Ray, our social media specialist, who during our updates today will be monitoring our Facebook Live event for any questions that may be posed either by the media or by our audience. And in case I forgot, I'm Don Walker. I am the Brevard County Communications Director, and we will get this program started with an update from the Department of Health from Barry Inman. Barry?
Okay, thank you, John. First off, we have seen a dramatic increase in our COVID cases, particularly in the last few weeks. If we go back to November, the third week in November, we had about 37 cases per 100,000. The last week in December, we had 815 cases per 100,000. And if I can explain that a little bit further, as an epidemiologist, if we saw like 200 to 300 cases per 100,000, someone was very likely to get this disease. With this is basically incredible. If you're not vaccinated, very likely, of course, if you are vaccinated, you may get this disease, but of course it's going to be much milder and a much less risk of hospitalizations, and of course of death with that. Unfortunately, we're probably going to see this number increase as time goes on, but with this, as we know, we had the holidays and people were getting together. There were large groupings that we know about and what have you, that people were at, and events, of course, that people were at, that greatly increased the risk for transmission, particularly those people vaccinated. The somewhat good news about the COVID, and particularly this Omicron variant that we're primarily seeing, although we still see Delta variant out there, our hospitalizations have not got to the level that we've seen with the Delta variant. So that's some good news there. And most of our people who are being admitted to the hospital are not vaccinated. They are unvaccinated in most cases with that. Our healthcare system is greatly struggling right now because of staffing, and of course, particularly their ERs and what have you, because of people coming in there to be evaluated, of course, for their symptoms. Our schools, we're seeing greater than 150 cases a day from school-age children. That has nothing to do necessarily with schools per se, but of that age group, which a lot of our kids are in that. And we anticipate large numbers of students out of the start days, of course, for school, which was just this past Thursday. The deaths are lower than what we've seen in the past, particularly with the Delta variant at that particular time. So that's good news, but there is a lag time. And we don't expect this virus to peak for another few weeks or so. That's our best estimate, if you will, with that. So we'll have to be sure. And since so many more people are getting infected, there's going to be those people that are going to need hospitalizations, and there may be some deaths, of course, with that. Vaccination, our school age, particularly 5 to 19, is climbing slowly. There's about 34% have had the vaccine in the county overall, about 68%. At the county health department, what we're seeing some more is our vaccinations are people getting boosted. And let me just mention that for a minute here. The boostering does protect better for people with the Omicron variant. With that, it boosts it to about 80% or so, of course, with that. And by the way, a lot of our vaccines only protect about 80% of the time. So this is a good thing, of course, to consider with that. But we still have 100 to 150,000 people in this county that have not been vaccinated. We need them to step up and be vaccinated. That would greatly help the situation that we have going on in Brevard County. One thing, too, is we know now people that can get vaccinated are generally 5 years and older. One of the things we have seen with our hospitals is that we have seen an increase in children seeking medical care because of COVID and coming to the hospital. Now, the problem with this virus is that it mostly affects the upper respiratory tract. Now, the good news, it doesn't go down into the lungs very well like our Delta did and some of our other variants before that. Since it's upper respiratory, and children with their small airways have more distress with this than the older individuals with this, and so they may develop syndromes like the croup, and that's where they have kind of a barking cough associated with this. So we know with the flu, you can't vaccinate a child till 6 months of age. So we always stress that the family be well vaccinated to help protect the children. So another reason to consider vaccination with that. We can't overemphasize, of course, we said about the vaccine, masking up, particularly if you're going indoors or what have you, even if you're vaccinated, because there is so much of the virus around us right now, we're getting exposed to it. Social distancing, 6 feet, of course, is important. If you're sick, and I can't overemphasize this, we've been saying it for 2 years now, if you're sick, please stay home. Please see about getting tested and what have you with that, and reducing your risk, of course, with that. And last not least, at least for the county health department, of course, there's other places to get the vaccine. Testing is from 8 to 5. The vaccine is from 8 to 5, but they do take a break at lunch from 12 to 1. With that, that's about all I have.
All right, thank you, Barry. I appreciate it. As we've said from the beginning, our emergency management department has been working very closely and partnering with our health organizations throughout the county for testing and monoclonal treatment, things like that. I'm going to turn it over to John Scott, our emergency management director, for an update on his end. John?
Thanks, Tom. Yeah, good morning, Everyone, my name is John Scott. I am the Director of Emergency Management for Brevard County. A couple things I want to just highlight as we go through our updates today. First is, I really want to emphasize what Barry just talked about, which is the amount of virus that is currently in our community and the high level of that, and the need for us to all continue to really be vigilant as we go through that. I know there's been a lot of interest in testing. We've seen all of our testing sites throughout the county significantly up as far as the demand goes. And I think, Logan, if you can put up the testing site graphic for me here, thank you. Those are 4 locations that Brevard County, the Health Department, City of Rockledge, City of West Melbourne, and Parish Medical Center partnered to make sure we had available for folks. And it's important to point out that we're actually doing more testing right now than we've ever done at any point in this pandemic. It's more available. It's not just at those locations. It's at Walgreens. It's at CVS. It's at Publix. It's at urgent care centers. It's at doctor's offices. There are other clinics throughout the community where you can go to find that info, or you can go to get tested. But again, so much virus leads to an increased demand for those kinds of things. And really what we're seeing is we're not turning people away, but we are seeing an increase in lines, an increase in wait times. So it's about demand keeping up with capacity. So we continue to work with our partners to increase that capacity, to increase that throughput at each of our sites. We think that's a good way to try to sort of ramp up to meet that demand and try to do everything we can to keep pace with it. But there is a certain point where so many people want such a finite item that it just makes it more difficult to deliver that service. I know sort of as we go through that, and Logan, if you could pull up the 211 information, please. I just want to highlight there are folks who are trying to figure out where to go to get that information. 211 Brevard has a service that's available where you can actually text 211 now. We'll have that graphic up. Thank you. That'll show you how you can do that, and it'll show you the current list of all the different sites that you can go, in addition to the pharmacies, the urgent care centers, to try to get tested. I know there's been a lot of conversation about at-home kits. A lot of folks would like that. That is an important part of our testing strategy as a county, as a state, as a nation. Yesterday, the governor announced a program to get more at-home tests available. The president and the federal government are working on a program to get more at-home tests available. I know all of our retail organizations are trying to get more at-home tests available. When it comes to the governor's program, when it comes to the president's program, we're still waiting on more advice for that. That stuff is coming, so please be patient as we work through those processes. As soon as they are available, we'll do everything we can to make them available to residents based on the programs once we actually hear details on them. So again, I know testing is in high demand. I just want to encourage people to please be patient, work to find the different resources, and understand that we're doing all we can to meet that demand. I'm going to switch gears and talk a little bit about the monoclonal antibody treatment center that we have in Rockledge. Continues to operate. One of the things about 3 weeks ago that site was forced to do is change to an appointment only, plus you had to be COVID positive approach. That was driven by the fact that monoclonal antibody there's a shortage both statewide and nationally on those things as the supply is down. Again, demand is way up, so we need to make sure we're sort of distributing that across the country. So as a result, limitation on capacity has been affected. So we've had to, again, go to a COVID positive, and you have to have an appointment. That means there are less appointments available every day. And there are less sites now than there were for the Delta variant. So again, it increases that demand. So we continue to work with our healthcare partners and our friends at the Department of Health and the governor's office to try to increase both our capacity and our availability there. You can go and register for an appointment, and Logan, if you would throw that graphic up, at the patient portal FL. Again, you need to have an appointment. Oftentimes folks will go there, they won't show any appointments. There's obvious frustration that goes with that. If you don't see any appointments, it's because they are all gone. And right now we are seeing appointments go pretty quickly once they're posted. So our best advice is to continue to check back, continue to visit those sites to make an appointment. But again, we ask for your patience on those things. And lastly, I just want to emphasize this. And we've talked for, this is year 2 or the end of year 2 for COVID for us. We've talked for a long time about, being vigilant with our COVID mitigation measures. Right now, that is crucially important. Again, Barry talked about the amount of virus we're seeing in our community. We know what it looks like from a testing perspective. We know what the numbers are every week as they come out from the Department of Health, and they're up. So that means that we're interacting with that virus more and more just as we go about our day-to-day business. So it is critically important that we are washing our hands, that we are wearing face coverings, that we are socially distancing, that we are getting vaccinated or boosted. And really, like most critically, and I say this all the time when I'm here, if you're sick, stay home, avoid people, because that's how we're going to slow the spread. We're never going to stop the spread, but we can slow down the surge. We can do a lot of things tangibly every day to manage what that surge looks like. And it's on each one of us as a community member, as a family member, as a neighbor to slow that down. So please, please, please help us with that. Stay home if you're sick, do all the COVID stuff that we know works, and we'll get through this surge. Don?
Okay, and I just want to reiterate, if you had a positive test and you want to get the monoclonal treatment, you have to have an appointment, and you can get that appointment at patientportalfl.com. And Logan, can you put the test sites back up? I want a point of clarification here. We were informed yesterday that the Department of Health Brevard has changed its hours from Monday through Friday, 8 a.m. to 5 p.m. That graphic has not been updated, so it says 6 p.m., but it would be 8 a.m. to 5 p.m. at the Department of Health in Brevard if you want to get tested. So after the holidays, kids are finally back in school, and we are going to get an update on their situation this week from Catherine Allen, who is one of their coordinators at the school board. Catherine?
Thanks, Don. Again, my name is Catherine Allen, Senior Coordinator with Brevard Public Schools. Obviously, school is back in session as of yesterday. We are expecting our cases and our quarantines to increase as numbers in our community continue to increase. We do have a list of safety protocols and current mitigation practices available on our website at www.brevardschools.org. But we are encouraging all students and staff to practice the known mitigation strategies that we've been talking about for the past 2 years, just like John mentioned. Good hand hygiene, mask wearing, social distancing whenever possible, and if you're ill, please stay home. Do not send your child to school sick. We will continue to be posting our COVID dashboard each Tuesday and Friday, and there's also a wealth of information and resources on COVID, such as quarantine flow charts, cleaning protocols, and other things that parents might need to know about, at-home screenings, just a variety of tools for parents. It's at www.brevardschools.org/COVID-19. So we will keep those updated. Lastly, we do want you to know that we're going to be navigating this new wave in the pandemic. Our educators and our school leaders are committed to keeping our students on track and continuing with their learning gains. So everybody is committed to doing the very best that we can in a challenging situation. Thanks, Don.
Thanks, Catherine. Barry mentioned hospitals. I did want to mention Fire Rescue Chief Mark Schillmeyer wasn't able to join us on our panel this week, and he's usually here. But he did give me an update that during the peak of the Delta variant of the coronavirus, they were doing as many as 30 transports a day to area emergency rooms of people that were having COVID symptoms. And at the current rate with the Omicron, they are transporting anywhere from 5 to 9 transports a day. So those numbers are down, although they are seeing higher numbers at our hospitals. So for the first time ever, we do have a hospital representative with us here today from Health First, and I'm going to turn the floor over to Lance Skelly, who is their public and media relations person. Lance, the floor is yours.
Thanks, Don. So just real quick, I want to thank you and your team, the county, the Department of Health, our first responders for all you guys do. Just on behalf of Health First, myself, my family here in Brevard County, You guys do so much just to keep us safe and informed, so we really appreciate all you guys do. I came with some information today, just basic information that I anticipated possibly being asked. First and foremost, our numbers at the hospital level. So our 4 hospitals within Health First today, we have 115 COVID-19 patients across those 4 hospitals. The numbers have been incrementally rising over the last couple of weeks. I think we've been around 100 to 115 all week. So the one positive thing we're seeing currently, if there's a silver lining, we have fewer patients in our ICUs. Right now, we have under 10% of the 115 plus patients that I'd mentioned in ICU. Now, of those 115 patients, only 6 are vaccinated. So that's about 95% of our patients in-house have not had a vaccination. So that's very telling there. I will say at the height of the Delta variant over the summer, our highest one-day count for COVID patients within our hospitals was 333. So hopefully we never come close to that number again. A couple of notables relative to our hospital operations. Effective today, Friday, we've implemented a slight amendment to our emergency department visitation policy. That's emergency department only. Our ED patients will be allowed 1 visitor at the bedside or in the waiting room. And of course, we're asking our visitors must be masked at all times. We have no other changes right now to the visitation policy across the hospital. So this, again, only affects the EDs. Secondly, this is an important one. We've made the decision to temporarily stop all non-emergent surgeries that require an overnight bed stay. So again, this is something that requires an overnight stay, non-emergent surgeries, also effective today. We're going to implement that for 2 weeks. The reason for this was so that we can continue to be prepared with space across our hospital facilities if needed. So you think about, again, over the summer, we had over 300 patients in our hospitals with COVID alone. So this is just a proactive measure. Don, you guys mentioned last week, you put out a really good communication that we fully supported about not visiting hospitals solely for testing. So you guys just a few minutes ago listed a number of places that people can go to get tested. And again, that's one of the great things your team does to keep our people informed in Brevard County. Our EDs are simply not set up to facilitate testing only. So, as you mentioned, there's a number of established sites across Brevard County, and the 211 text line that you had mentioned, as well as 211brevard.org, those are excellent resources with up-to-date information. So I highly recommend those. Health First does continue to provide vaccinations, including boosters at our Sheridan Road facility. So if anyone needs more information on that, you can always visit us at hf.org/staywell, STAYWELL. Finally, today, we're going to begin updating our COVID-19 patient counts via our Facebook and Twitter social media pages. And just like the schools, we're going to update those every Tuesday and Friday.
All right, very good. Thank you, Lance. Appreciate that update. As we normally would do at this time, we'll turn it over to Jesse Ray, who will pose your questions that you've posted since we began, and we will try to get those questions answered. Jesse?
All right, so we got quite a few to go through, so let's get started with some of our media questions. What have been the trends that you are noticing related to new case counts for vaccinated versus unvaccinated patients? And are you noticing a difference in the severity of the symptoms between the vaccinated and unvaccinated people with COVID?
I guess I'll speak to that. Those people who are vaccinated, the rate of hospitalization and the rate of infection is much lower with them. So the vaccine is very, very effective. Hospitalizations, as Lance just said, of the cases that they had, 95% of those that were admitted, went through the ERs, were 95% were not vaccinated. So that's an impressive data point that is very, very true. As we said, though, people may get infected. By the way, that can be with any vaccine. But as we said earlier, that is much less likely for severe outcomes and hospitalizations.
Okay. Where do you think the case counts are heading in the coming weeks? And when do you think the case totals will peak and start dropping?
That's an estimate, but with the data I think we have right now, it may peak in the next 2-3 weeks or what have you. Please don't hold us to that. This virus has been extremely hard to predict, of course, with that. And then maybe sometime in February, we may see the incidence of this disease drop. But we'll have to wait and see. This virus is, and one of the things about COVID we have to understand, we are all very susceptible to this virus. This is a virus your immune system has never seen. Now, your immune system has seen the flu and all that, although the flu, as a matter of fact, the flu mutates more than COVID does. But there's a lot of people that can still get infected with this virus out there because we are extremely susceptible to it, and this Omicron is extremely transmissible. It's as transmissible as measles, which measles could infect 12 to 18 people if you're infected, if you're infectious with it.
Okay, thank you. For Catherine, are teachers and student absences so far this week higher than expected?
I think that might be a difficult question to answer. Just like what Dr. Inman was saying, this isn't something that we've seen before. So we can't say that we expect any certain percentage, but we're very well prepared that we know we will see absences. And so far, we're not surprised by what we have seen.
Okay, thank you. Is there any way, anywhere that people can see the actual numbers or statistics for hospitalization of those who are vaxxed versus those who are not vaccinated?
I think we just answered that pretty much, yeah.
Okay, just wanted to make sure. So Lance, is the severity of the disease and the complication rate similar to that of the seasonal flu?
Again, I think I'll defer that to our physician expert here.
Let me be blunt, no way. This is incredibly, with the flu, you may have 100, maybe 200 cases per 100,000, but nothing like 800 cases per 100,000.
Right.
And by the way, if I could talk about the death rate for COVID, the Omicron might be a little bit different, but it's about 2%. With the flu, it's 0.1%. Okay, so there's a lot less complications with the flu. I mean, even in a severe flu year, which we had in 2017, 2018, we had 80,000 people that we think died of it with that. So we're seeing a lot more. And like I said earlier, the flu, people have been vaccinated for it. Your immune system has seen the flu before and has some protection, even if there's variants that's not too protected. But with this COVID, our immune system is at its will.
Gotcha. So considering how contagious this is, are we, and we're seeing staffing issues everywhere, do we have plans to help deal with the issue?
Is that a hospital question?
Yes.
Okay.
It is now.
So we're prepared for this, as we saw over the summer. So we have a whole host of different things that we can do. We're lucky at Health First that we're an integrated delivery network. And so what that means is we have physicians, nursing staff, clinicians across our entire system who may not be based in the hospitals, but may be based in doctors' offices or clinics. And as we saw over the large spike over the summer, we had a number of individuals that came over into the hospital, so they platooned in. That was really exciting to see. A lot of people volunteer to be on the ready for that particular instance. So we do have that. Some of the other things we enabled during the highest spike, we instituted some tents outside of our hospitals as sort of a makeshift overflow for emergency department patients to sort of separate COVID patients from in-house patients who are there for other reasons. So we have a whole host of tools that we can use if necessary.
Excellent, thank you.
Hey, Jesse, I want to just touch on one important point there, because we get this a lot, like, what are we going to do? How are we going to fix this? And it's an important part that's a half of the conversation. This isn't just a government and a healthcare problem for us to fix. This is a community problem for us to address. And we can do something every day as people who live in Brevard County, people who visit Brevard County. We know what that is. That's our COVID mitigation measures. It's important that we as residents don't view our role as passive in this, but that we have active, tangible solutions we can put in place to help slow the spread and protect our neighbors. And we should be doing that every day.
Okay, excellent, thank you. So far, are there any deaths that are contributed to Omicron, and that's for either Barry or Lance?
We've had some deaths, but like I said before, they're way down. We have none that have been verified by that, but that doesn't mean it has not occurred. As we know, not everybody is tested, for these variants.
Thank you. So Catherine, kind of going back to the staffing shortages that we're seeing based on people being sick and such, are we worried about any kind of school closures because of staffing shortages?
I wouldn't say that we're worried about it, but it's certainly a possibility if we reach a threshold. But like our hospital systems, we're also lucky that we have several people that are trained in classrooms right there at the district headquarters, and to our dedicated substitute teachers that have been out there serving their community in that way. So we will do everything that we can do to ensure that we don't have to close a school. It is a last resort for us. However, we are ready and willing to stand in the gap wherever we need to.
Okay, thank you. The monoclonal antibody treatment, is that effective against the Omicron variant?
Barry, I'll let you start with that one.
Okay. With the Omicron, it is usually less effective. It's not to say that it's ineffective with that. We do have one monoclonal that is at least, in laboratory data and some of the what the experts convey that is more effective, but it's hard to get a hold of at this point. So hopefully that will correct itself, in the near future.
Yeah, and I was there was a question kind of also similar to that. So is there anything that we're doing? Are we trying to secure antibody treatments that are more effective against the Omicron?
I'll take that one. Yeah, we continue to work with the Department of Health in Tallahassee, the Florida Division of Emergency Management, and the Governor's Office to secure as much of it as we can. They are working very diligently on it. As soon as it gets available to the state, CDR Health, which is the vendor who we partnered with to run that site, is working very closely to get as much as we can, and as much of the newer, because the one that Barry is highlighting, that is the newer monoclonal, and it, like I said, it takes a while for that supply to ramp up. So we are doing everything we can.
Sure, thank you. Either Lance or FDOH, do we need to be concerned about other viral infections like the flu? I'm sure some of us have heard of the flu Rona. Is that a great concern for us, or not quite yet?
Well, the flu is increasing, but typically we don't peak, particularly in Florida, until January or February with that. And one of the things about organisms, they do compete with one another, just as though humans are competing with all the animal species and other entities out there. So it is interesting, that they compete. So we'll have to see. It may be somewhat less than what we've seen, without COVID, and that was certainly the situation last year. But like anything of infectious diseases, can be hard to predict with this. But we'll see. But we're not peaking. We are seeing more cases than we saw last year. That's for sure. But we'll have to see in the next month or two what occurs.
And I'll just say, from a hospital readiness standpoint, these are things we've been prepared for as well. We anticipate, with the visitors vacationing, the holidays, the snowbirds that are down here temporarily, we're able to flex our staffing, our resources, make sure that our supply chain is in good shape. So these are things we were ready for in the beginning.
Okay.
And if I may say, please get vaccinated for the flu, please, because that helps. Vaccination, the flu can cause people a lot of problems, and is extremely infectious also.
Okay, thank you. John or Barry, we preach every week about staying home if you're sick, but staying home from work isn't always an option for our low-income residents who have to go to work. They need that money. So what options do they have if they are feeling sick?
So I'll start with that, Barry. And the quickest answer to that is, one, vaccines, because that's going to give them the most protection and hopefully keep, if they are symptomatic, hopefully keep those symptoms mild. And then two, the CDC guidance also says, if staying home is not possible, then you need to make sure you're wearing a mask at all times. So a well-fitting face covering like an N95 or a KN95 will give you the most protection. Again, not just you the most protection, but those you're interacting with the most protection, because the goal with that is to slow the spread and reduce the amount of people who we're exposing. We understand that's not always possible, and in those cases, those are the things folks should be doing. But again, if you have the option, if you can make it work, the absolute best answer is to avoid people at all costs if you're symptomatic.
Okay. And then Catherine, kind of similar for you, for those low-income families, when they have a child who is sick and they can't necessarily stay home to take care of that sick child, do you have any suggestions for how to handle that situation?
That's a tough question, Jesse. The school's position will always be, please, please keep your sick children at home. We certainly understand that there are a lot of different economic situations that make it difficult. Reach out to a relative. There are some pediatric healthcare, I think in Brevard potentially, maybe John, correct me if I'm wrong. There are some pediatric care centers for children who may need to be watched if they're sick and the parents have to go to work. Is that correct?
Well, I think this kind of goes into what John was saying earlier, as far as this is a community, thing. And like you said, relatives, friends, if there's any way
Yes.
that your community members can help in that situation to help keep that child home if they're sick, I think that's where that comes into play, right, John?
You are nailing it.
Got it.
Yep, very good.
I tend to do that sometimes. Thanks, John. Okay, just a couple more, because I know we have a hard stop here. Is there such a thing as too many antibodies? If you've had COVID, you have those antibodies. You get the vaccine, you have those antibodies. You get the monoclonal, you have is there such a thing as too much? Is it going to cause harm?
There is a possibility, but generally it's no. It's no. I know antibody levels for COVID, can go into the millions or trillions or even, with that. And we have no evidence, particularly with COVID, that's what we're talking about, of it harming the immune system at all at this point.
Okay, excellent. And I've got one last one, which I think is a great question. There's several people on here who want to help. They want to volunteer. They have medical experience. They have, the option, they don't work, they're retired, what have you. Where can they go to get involved? Ooh, Catherine wants to take that.
I am going to take that and use this as a plug. Substitute teachers, we are in desperate need of substitute teachers. So we have waived all of the fees. You can find that information on our website, and that is definitely a way that you can step up and help your community. Maybe not necessarily from the medical perspective, unless you want to consider mental health for employees and staff, and keeping our kids in school where they are doing their best learning gains. So for the school's perspective, we would love to have you come volunteer and be a substitute teacher for us.
I'd like to jump on too. Obviously, Health First, we have a very robust volunteer services program, well over 1,000 people. And so, we are always looking for interested volunteers. They can go to our website at hf.org to find out more information and sign up as well. So always welcome that.
And I think, I assume on our end, you could also contact 211. Would I be correct in that assumption?
Yeah, you can contact 211. There are a variety of community organizations that have a piece of this response. I know for those with medical interest, there's the Brevard Health Alliance, there's the Department of Health, there's a variety of places. So glad to hear people want to get involved, super excited about it.
Yeah.
Obviously, if they need help connecting, we can help with that as well.
Excellent. That's all we've got time for today, Don. Thank
Okay,
you.
so on that positive note of people wanting to help their community, we will wrap up today's program. I would like to thank Lance Skelly for being here with us today, along with Catherine Allen with Brevard Public Schools, Barry Inman with the Department of Health, and of course John Scott with Emergency Management. We ramp up these weekly updates as the coronavirus cases tend to surge, and so we will be planning to continue these for the foreseeable future on Fridays at 11:30. And if any of that changes, we'll send out notice in advance. But beyond that, we are completing today's program, and thank you for joining us.